Just 3 years into its opening, Yekatit 11 hospital has no longer able to provide care for many patients that visited it every day. Yekatit 11 Primary Hospital is just one of the many hospitals in Tigrai that are no longer able to provide essential care for their patients due to the depletion of medical supplies. The hospital currently has 250 chronic illness patients under its care, to which it used to provide not only medicine but routine checkups for. Now, Medical Director of the hospital, Dr. Idris Abdu, says many of the patients remain in critical conditions as the hospital struggles to help its patients.
شاقزيت تمزجو ناي سوبر أزماتيكنا دم بسد بال كختمت حمسة يلخنو تحكمتي تمزجو الكتاتول لونا مالتي.
We have around 250 chronic illness patients at the hospital. We don't only use it to provide medicine for our patients, but we also use it to conduct baseline examinations for them. However, we are unable to run such tests as our laboratory is depleted of essential medical supplies. Our patients also couldn't afford to pay for their laboratory tests at private hospitals due to the economic crisis caused by the current situation. So we are not able to help our patients.
Pregnant mothers are also being forced to give birth at home, added the doctor. He says termination of ambulance services due to lack of fuel and telecommunication blackout are main factors.
Ambulance service almost complete.
After the incident, the ambulance service was completely terminated, and as a result, women were forced to give birth at home, as they have no access to telecommunication and no chance for getting an ambulance service. We are also run out of reagents, so we are no longer providing laboratory tests for malaria, hepatitis, VDRL, and HIV, which are critical tests especially for pregnant women.
Dr. Idris also says emergency care at the hospital has also been compromised. Asthma patients seeking immediate care and diabetic patients in need of insulin are simply being turned back.
Theoretically, last week,
Last week, a child whose blood sugar increased was coming here to get help, but I couldn't be able to help him as the hospital is run out of insulin, which is helpful to lower the level of blood sugar. We had also hypoglycemic patients, but we couldn't be able to help him as we don't have glucose 40%.
A month into a peace agreement that promised unfettered humanitarian aid, the amount of aid that has entered to Tigray since is nowhere near the demand.